Right, so I'm going to just then in the next few lectures, just with a couple of lectures, talk about lymphoplasmacytic gastritis in cheetahs and some of my theories on this and where we are in terms of some of the research. And then also I'm going to try and latch onto that then a very short lecture on the renal failure or kidney failure in cheetahs. So just some of the background. I mean, this is, as I've already indicated to you, a common chronic disease of captive cheetahs. More than 90%, as in that one study, 90% of adults were affected to some degree. Now, that doesn't mean that they're going to have any clinical symptoms, but if you had to biopsy their stomachs, they would have evidence of gastritis in the stomach biopsies. This was the first paper by Eaton that came out, and this was also in the 1993 on what they called then epizootic gastritis associated with gastric spiral bacilli in cheetahs. And the whole Helicobacter story had really come to light in the 1980s when they suddenly figured out that Helicobacter actually caused peptic ulcers in humans. I think the researchers who first discovered that got Nobel prizes for their discovery. And I think even one of the researchers actually infected himself and showed that he, with a dose of Helicobacter and then developed ulcers himself. But I mean, these are astronomical doses that he's giving himself. But anyway, so this was on the back of that, and they, came in. And one of the comments in this paper, this came out first, and which has kind of set the tone for everything with regards to gastritis after that, was gastritis in these cheetahs was somewhat similar to gastritis caused by Helicobacter pylori in human beings. The problem is in that word somewhat, which actually, is actually really nothing like. So a primary issue is that the lesions that we see are in the fundus, which is the glandular part of the stomach, okay? Whereas Helicobacter peptic ulcers occur primarily in the pylorus, which is further down the non-glandular part of the stomach. And what we see is why we call it lymphoplasmacytic gastritis is because these plasma cells and lymphocytes, which are white blood cells, different types of T and B lymphocytes that infiltrate parts of the stomach. And if you look at this, these are pictures from Professor Emily Mitchell from histopathology parts of the stomach. This one over here is a fairly normal stomach, okay, with just a few spots around. And then you can see this one over here, those black or dark purple cells that are spotted all over the place are the white blood cells that have infiltrated that area and indicating the inflammation. What you see with the naked eye or macroscopically is just this kind of, there's usually a bit of reddening, but then the pitting where you get these kind of white spots. And if it gets really bad, the surface of the stomach, instead of having what those rugal folds, which are those very smooth folds that you see on the inside surface of the stomach, are replaced by what we call a cobblestone effect. So it looks like a road that's been paved with cobblestones. It's just bumps everywhere. But the problem with it is that you can't just scope and look at the stomach, and I mean, if it's really bad, you can see it straight away. But you can still have a grade 2 or even grade 3 gastritis that is not visible with the naked eye, and you actually only will able to diagnose it on biopsy. But those cases are usually not clinical, so the animals are not actually physically sick at the time. Most cases are chronically and subclinical, so there's no actual obvious clinical symptoms other than usually a bit of diarrhea or a dark stool. It's just a watery dark stool. I always would say that in carnivores, carnivore feces usually has to be dry and solid. Okay, that is the normal state of a carnivore's feces. Anything that is soft, I mean, is usually indicate that there's some problem. And now that can be temporary, and that's not too much of an issue. We don't worry about the one or 2 days of a soft stool if the dog has eaten something weird. But if they have persistent, soft stools, that's not normal for a carnivore. Carnivore feces is normally very, very dry and solid. And you should be able to, I always say to students, you must pick it up with your fingers and you must have nothing left other than maybe a bit of mucus on your fingers. But you must be able to pick it up and, you don't want anything left on the ground either. It must be solid enough. So these cats, there's no loss of appetite in most cases that are mild to moderate. There's no weight loss. They don't really lose much weight, despite the fact that they've got a raging maldigestion in many cases. So they don't really lose much weight. And weight loss, or you don't often see a cat that's very, very thin. If they're really thin, then it's usually chronic kidney failure. It's not gastritis that's causing the loss of weight. And they might have a mild regenerative anemia, and then sometimes clinically we just see a slight increase in urea with a normal, and that's just often because there's some bleeding in the gastrointestinal tract. So the urea goes up, but the creatinine, which are two things we normally measure of kidney failure, but the creatinine is normal, so we know that the kidney function is at least relatively normal in most cases. So this is just from the European best practice guidelines on cheetahs, and they have a fecal scoring system. The only thing that I disagree with is that they consider kind of 3, which is kind of a formed but soft stool, as normal, and I would say that 1, 2, and 3 are potentially normal. 4 and 5 definitely not normal, and definitely are a problem. And there should also not be much of a smell to the feces. You have to stand right next to it before you should be able to smell it. If you smell it from a distance, you know that there's a problem. So the clinical signs in severe cases are usually vomiting, regurgitation of food, melena, which is a black, means that there's bleeding into the intestine. So the stool is black or dark in color, very dark in color. And there's often undigested meat that is coming through out in the feces. We have a very poor coat condition if it's chronic. And then other things that are a little bit more difficult to identify, like small intestinal bacterial overgrowth, hyperchlorhydria. Sometimes you can get, if you scope them, you can, as you go down the esophagus, you can already see that the esophagus is quite inflamed because of this regurgitation of gastric content into the esophagus. And then sometimes, and we've had that with one of Cheetahs recently, that they actually chronically regurgitate and then aspirate the fluid into the lungs, and then you get a chronic bronchitis. So they start coughing, but they have this chronic cough. That's also due to the underlying causes gastritis. And then a question mark about renal amyloidosis. I don't think it's really associated. So that's a form of kidney failure that's associated, that many people still believe is associated with gastritis. Recent studies really show that it is not associated with that. But gastric ulceration is very, very rare. I've never seen a cheetah really that has ulcers, actual ulcers in the actual stomach. And that's important when it comes to some of the treatment options that would normally have with it. This is just a video from one of the cheetahs kangaroo that we scoped and biopsied, and that's the biopsy that we take from the stomach. This cheetah's got quite a lot of hair in the stomach, and that's not unusual. They can get fur balls like cats do, and that can sometimes, it very rarely causes any actual vomiting, because the hair sticks to the actual mucosa of the stomach, and it's very difficult to pass the hair through. But obviously when cheetahs don't groom themselves as much as cats do, and you hardly ever see them grooming much other than basic groom here and there, which is quite odd. But so they often don't end up with a lot of hair unless they're eating prey items that have got a lot of hair. Then they can also get a bit of build-up of hair, but it's often not really a serious problem. So the diagnosis is basically often just on the fecal consistency, and if there's undigested food in the actual feces, then you know they've got gastritis. You don't even have to take a biopsy to know that, because there are very few other causes of that kind of maldigestion issue. We can do a fecal smear, although that's really not that helpful. And then one of the problems is all the serum, normal blood tests that we do, they tend to be very normal. We don't see, we can run a full panel of blood tests that we normally do on dogs and cats on a cheetah, and it's not very common to actually find any significant variation from normal values, even in some severe cases. So not that helpful. So the basic diagnosis has got to be a gastric endoscopy and stomach biopsies. And normally we would take at least 9 to 12 biopsies from the stomach. And you can see you'll see now from this one in the video over there, you can see that they're bleeding a little bit from those biopsies, but they heal very, very quickly, those little punch biopsies. It's not a full thickness biopsy. It's only just the mucosa and submucosa that are taken and then stored in formalin and sent to the lab. And then usually they're scored based on a scoring system of grade 0, which is no gastritis, grade 1, which is mild, 2, that is moderate, and 3, that's severe. And we have one pathologist who does all of that scoring, so it's fairly consistent. Some of the other possible causes for very similar symptoms can be kidney disease, renal disease. They can have gastric ulceration. I've seen wild cheetahs that are suddenly coming to a very, very stressful environment. They can develop stomach ulcers. They can also get stomach ulcers from any of the non-steroidal anti-inflammatory drugs that we would use in dogs and cats, as well as in humans. Aspirin, paracetamol. Well, you don't want to give paracetamol, probably kill a cheetah, but ibuprofen, diclofenac, which is Voltaren, or any of the things like Metacam if they're used at the wrong dose. All those kinds of things can cause stomach ulcers and vomiting and so on, if they're not given correctly. There's one particular stomach worm called Olulanus tricuspis. I haven't seen clinical cases of this, but they apparently are a few around. It's more of a European problem. And they are generally easily treated. So they would also be vomiting. It's a cat gastric worm that is relatively rare. Coccidiosis in very young cats could also cause this, but you wouldn't highly unlikely to get coccidiosis, which is a protozoal infection in the gut in adult cheetahs. It's certainly very few cases. And then panleukopenia, which is the kind of cat parvovirus, could also cause vomiting, but again, in young cats, unlikely to be in an adult cat, and certainly it's one of the things that we vaccinate against, so unlikely to be a problem. And usually there you've got, the animals very unwell, they're depressed and so on. So it's not the same as for gastritis case, where the animals appear quite normal in between the bouts of vomiting and so on. So in the terms of the treatment, historically, and this is based entirely on the fact that it was similar to Helicobacter, they used to use this triple therapy, which is omeprazole, which is an anti-acid drug to reduce the amount of acid, metronidazole, which is one type of antibiotic, and then amoxicillin. They evaluated this, and they get better for a period of time, but then they relapse again, once the treatment is finished. So this was back in 2004 that this paper was published. I certainly don't treat them with those anymore. They benefit from the antibiotics, but I suspect that the main reason why they benefit from the antibiotics is because of the small intestinal bacterial overgrowth. So that it improves that dramatically, and I only put them on amoxicillin with clavulanic acid for 7 to 10 days, and they often they improve just on that alone. Without the need for any anti-acid medications or any other antibiotics, added to it as well. And then the main treatment, which we'll discuss in a moment, is the dietary changes that are required. So we've talked a little bit about this as possible cause, Helicobacter pylori, the main bacteria in the stomach, the spiral bacteria that occurs in the stomach of humans, animals. But the problem with this is that actually wild cheetahs also have, when they looked at wild cheetahs and they cultured the bacteria from the stomachs of wild cheetahs, they found that there was Helicobacter there too. So the incidence of Helicobacter in wild cheetahs and captive cheetahs was about the same. And they initially got a bit excited when they found a particular strain of Helicobacter in cheetahs, which then was named Helicobacter acinonyx. But it doesn't seem that special, and it certainly is not the major the bacteria that we find in most of the cheetahs. Pylori is much more common, but the wild cheetahs don't have gastritis. So the bacteria is present there, but none of the actual clinical symptoms. Actually, very, very rare. There would be some other, reason why they would have inflammation in the stomach. But I can't think it's, I don't think they've ever found a real case of gastritis in a wild cheetah ever. So that one really doesn't look like a likely cause and effect as such, and I say that's very unlikely. Then stress again, obviously that's come back as a major cause, because in humans that get stressed, we can develop stomach ulcers and stomach problems, and so it's easy to just put the two together and say, well, okay. But the two are very, very different. When you get stressed and you develop these peptic ulcers or these ulcers, again, as I said, I've seen cheetahs that are stressed and they develop ulcers in the pylorus, which is much lower down, not in the glandular area. And none of these cheetahs that have actual gastritis actually have got ulcers. I suppose that stress could still play a role, and there's still even colleagues of mine who still adamant that it's stress that's causing that, but I think that there's really very little evidence. It means that 90% plus of cheetahs in captivity are stressed, and there's no evidence that it doesn't matter whether you have them in a situation like this where there's virtually no visitors, you can still have gastritis here. And for me, most of the history has got, I can tell if you tell me what you're feeding them, I must guarantee whether they're going to have gastritis or not. And the most common background history that I get is, we're feeding them, there's some reason we're feeding them chunks of meat, particularly horse meat or muscle meat, and we're feeding them twice a day, and we've been doing that for the last 2 years or whatever. Then you can almost guarantee that cheetah's going to have gastritis. Frequent feeding of mainly muscle meat, even if you put the supplement or not, it does. So the collagen content is extremely low, the muscle meat content is very, very high, the feeding frequency is high, feeding twice a day or something like that. Those are the animals that are going to get severe gastritis. And so the dietary causes, I think, are really far more plausible. There's been a little bit of research on this. Again, my colleague Emily Lane, who's now Emily Mitchell, has done one study, and this was done at Anne van Dyck's Cheetah Center, where they looked at 2 different diets. Now these diets, one contained some IMs, so about 30% of the diet was IMs, and the other one was just, I can't remember, but there was a difference in terms of the actual development of gastritis, and the ones that had IMs actually had lower development of gastritis. And my simple argument would be there that, it's a lower protein diet, so you've got less protein for fermentation and so on, and it's probably, you're going to get less protein fermentation products as well in those diets. The effect, though, was very, very small. The difference between the 2 diets. It wasn't a massive improvement when you compared one diet to the other. So this is my theories really now is the low collagen intake and the frequent feeding, common in animals fed twice a day. The project that we initially started and still actually ongoing at the moment, trying to study this, started at the Africa Foundation in Namibia. And there I had a number of adult cheetahs between 3 and 15 years of age. They were all born in the wild, and so they are not, there's no inbreeding or anything like that. These were animals that were caught by farmers as cubs or whatever, and ended up at the foundation, and then became captive animals. So 86 sample sets were collected, biopsies together with a whole bunch of other blood and urine samples that we evaluated. And this just was over a number of years, so just quite interesting to follow the progression over time. You'll see the grade 3 is in red, grade 2 in orange, and grade 1 gastritis here in green, and just the numbers of animals and then the proportions of them relative to the sample population. And it appeared like things were progressively getting worse between 2015, 2016, 2017, and then all of a sudden, 2018, bang, 15 animals that have very mild gastritis or no gastritis, and then only 3 animals that had grade 3 gastritis. During these 3 years, I had been really developing the idea of the collagen supplementation, and I think they really instituted it in 2017 after they things were getting pretty bad, and they started feeding a lot more of the carcass components, and suddenly the next year the levels of gastritis had improved dramatically, with only a few animals that still had grade 3 gastritis. Just in terms of males and females, only a slight difference, and this isn't really statistically significant, but slightly more males than females, or that it was slightly worse in males than it was in females. And then just in terms of age, this again just shows you the ages at the bottom from 1 to 15 years, and you can see that even animals, we didn't have very young cheetahs in this population, so no 2-3-year-olds. So there was either 1 year and then jumped straight to 5-6 years, but from 5 to 6 years they already got quite, there's a gradual deterioration over time, getting slightly worse. But actually, if it's not clear that sometimes they will get better and sometimes get worse with age. With age is definitely a potential factor, in that they tend to get worse as they get older. In terms of the serum biochemistry, there wasn't really much different that we could find. There was a few things in terms of creatinine and albumin levels in the blood. which I'll show you in a moment, but otherwise everything else looked pretty normal. And these were not big clinical differences, so it actually becomes very difficult to diagnose this simply from a blood test. You can't really see much. So the serum creatinines were higher in the cheetahs that had a grade 3 gastritis, slightly higher, not a great deal, okay, than those that had either a score of 1 or 2. And then the serum albumin, so albumin is a protein in the blood. It's often made in the liver, but it was lower in the grade 2 and grade 3 gastritis than in grade 1 gastritis. Cortisol levels, and this just again to re-emphasize the stress levels, potentially slightly higher in grade 3, but that wasn't statistically significant. I mean, they're pretty much the same. So serum cortisols didn't vary between cheetahs, again indicating that stress isn't really a major. I mean, a single serum cortisol is a bit difficult to evaluate on its own, but certainly there was no additional evidence that stress was playing a big role in the gastritis. On the urine which we collected, there were some differences as well, that the urine specific gravity was lower than in the grade 2 and grade 3, and the main reason for that was because of the urine urea, which is the main. I mean, cats, because of high protein diet, they excrete an enormous amount of protein breakdown product, which is urea, and urea is the main element in urine that gives that influences the specific gravity or the concentration of dissolved solutes in the actual urine. It's by far the most common molecule in there. And actually these animals were excreting less urea in their urine, indicating that there's either a problem with maldigestion or a problem with the actual whole urea cycle, which we've discussed previously. So this was then just some data they recently got from the Kango Wildlife Ranch study, which happened, I think, last year. And we had 10 cheetahs that we basically at baseline sampled them. And okay, just to give you some idea what we did, they were originally on a particular diet. For this trial study, which actually had to do with glycine supplementation, we had to then feed them basically a meat-based diet itself. So we thought like in 3 weeks' time, we can give them, we'll finish their normal diet, and then for 3 weeks we feed them just meat with a supplement. So this is because the whole problem is I want to supplement them with glycine. I don't want to have a lot of background collagen there, which is going to provide a lot of unknown or unquantifiable glycine. So I'm going to feed them mostly meat, muscle meat, but with a supplement, but no glycine in the initial period for 3 weeks. Then I'm going to sample them at baseline, and then half of them I'm going to put on glycine supplementation, and half of them they're just going to carry on with the non-supplemented meat with a general supplement that doesn't contain glycine. And so what we found was that the baseline actually was really good. Most of them, there was 5 that had a grade 1 and 1 that had a grade 2. Well, the rest actually had no gastritis at all. Then those that that continued with no glycine, actually 2 of them then developed a grade 3 gastritis. 3 of them developed grade 2 gastritis, and so all of them basically had some level of gastritis. So that wasn't bad. Then in that group that were given glycine, slightly better, but you can still see that there's still 1 there that has got to grade 3 and 2 that have got grade 2 gastritis. So better, but not nearly what we had at the baseline. And what we realized out of this study was that prior to this, Craig and them had been feeding quite a lot of collagen, and then when they withdrew the collagen, it still took more than 3 weeks before these cats deteriorated to the point. So they actually had, when we sampled them at baseline, they were still doing quite well based on 3 weeks of the original feeding that had happened. Then they gradually deteriorated, but the glycine did help a little bit, but not as much as feeding them as the collagen-based diet, which they had originally been on prior to the start of the whole trial. So you can see how this can become quite complicated in terms of trying to study it. And this was just now the individual animals. It's maybe a bit difficult to see. You can see all their names listed on the left-hand side there, and then you can see that once again, with no glycine, there were 2 of them that really got grade 3 gastritis, and about 3 that got grade 2 gastritis. There was only 1 individual that actually got worse after glycine supplementation. But you must remember too that the actual time period of them having been on this original diet where they were getting quite a lot of collagen, now it was getting further and further away. And so even with glycine supplementation, that's why I say that 30 grams of glycine doesn't seem to be enough to actually reverse some of the clinical symptoms, and that the collagen itself seems to be far better at doing that. So now what we've done there is those cheetahs that really struggle with taking the extra collagen in their diet. With them, we're giving them the glycine because it's still better than nothing. But we might struggle if we have to try and go above 30 grams of glycine per day. Just to be able to get it into them. They're not necessarily going to take it. And there may also be other components in collagen, because it's not just glycine in there, that may affect the bacterial makeup in the small intestine. And it may actually be other factors in collagen that are adding the extra bit of help in terms of preventing gastritis from developing. So the current real treatment recommendations, or even prevention recommendations, are that the diet shouldn't contain more than 50% muscle meat, and then the rest must be made of collagen, tendons, bones, lungs, aorta. Be careful of bones, though. I mean, and that's the same thing. Once you've got a cheetah that's got gastritis, bone is actually a very good source of collagen, because the matrix of the bone, not the mineralized part, the matrix of bone is very high in glycine as well. The only problem with that is that these animals are not really digesting bones. They don't have enough stomach acid to digest bones, and if you suddenly introduce them onto bones, especially bones that are already broken up, they're going to swallow pieces or chunks of it. If you give them a long piece of bone that they can chew on, they will bite off small enough pieces that won't get stuck in the intestine. But when you suddenly give them you chop the bones into small pieces, and they'll swallow the whole thing whole, and that piece will just go through and get stuck in the intestine and cause a problem. Normally we would treat the clinical cases where they're actually showing symptoms with antibiotics. So if they're vomiting or regurgitating, or they've got a esophagitis, or if they've got undigested meat in the feces, we would give them antibiotics for 7 to 10 days. I don't use omeprazole or any of the other acid blockers or antacids at all. The only one that I would use is what's that, my white milky thing that Alsanic. Yeah, which doesn't actually reduce the actual acid production, but just provides some protective layer in the stomach, and that's only an issue if there's an issue with potential ulcers. It's usually not required either. And then I use the gastric care supplement that we have that has very high concentrations of creatine, glycine, and vitamin B5. And I'm actually going to, when I reformulate it now, I'm going to add another thing, which is vitamin B3, which in some studies in humans has shown to increase stomach acid production at fairly high concentrations. We're talking probably 20 times what you would normally, give. And then the other thing that we do is then we try and start increasing the starve days, so that we get up to about 3 starve days per week. So that means 3 to 4 feeding days per week. Okay.